Healthy Child Uganda is a wonderful story being told in southwest Uganda today. In rural Uganda, as in other less resourced parts of the world, children still die from illnesses like malaria, pneumonia, diarrhea, and malnutrition. Many newborn babies do not survive the first week of life. Many women still die due to complications from pregnancy. These deaths can be prevented. Healthy Child Uganda develops, implements, and evaluates programs for training and supporting community health worker volunteers called Village Health Team members. These volunteers are local people living in the villages who are selected by their own communities. Village Health Team members provide good health practices like good hygiene, nutrition, and healthy practices to prevent illness, such as use of mosquito nets to prevent malaria. And they also assess pregnant women and sick children. The network of HCU-trained volunteers is now more than 5,000 people strong.
Okuba VHT n'omulimo mulungi.
I'm happy to be a VHT because I've benefited and my community has benefited. For example, even when it is during the night and someone gets ill, I write them a referral note, and even though the health center has closed, but the health workers who stay around are able to help them simply because they got a note from the VHTs. And personally, as a VHT, I'm very happy because people respect me as the health worker at the village. Our children are no longer getting sick like they used to get sick because now they know that they have to get immunized for polio and other immunizable diseases, but also most especially when we have programs for children to go for deworming and for vitamin A. The communities really take it up and they sleep in bed nets.
I don't even have the right word to describe their commitment. They walk long distances to visit children, home-to-home visitations. They promote hygiene in their communities. They have gone ahead even to accompany mothers and the children who come to the health centers. They even follow up. You know, they care. Their care is beyond what one would think.
As well, Healthy Child Uganda trains health workers to manage deliveries and sick children safely.
Breathe, 1, 2. And we shall do this for 1 minute. Okay?
Many health workers have minimal formal training and may even work alone at very remote health posts.
They get the skills very quickly, but we also know that they lose the skills very fast. And what has been very helpful is really offering these refresher trainings that we have been doing over the years to really revamp people's skills.
3, 1, 2.
Baby Justin is at risk of getting malnutrition.
HCU training has reached more than 300 health workers. Early and confident treatment will save lives in the children and mothers they serve.
Before the training, yes, I had the skills, but I improved. My skills were improved. So after the training, now I'm skilled about how to fight asphyxia using a bag and mask. I came to know the steps through which I can help a baby to breathe when the baby is born not breathing.
From developing data management systems to leadership training and mentoring for district health leaders and managers, Healthy Child Uganda works with local teams to identify and then address their priority health issues and manage challenges. As a university-led partnership, Healthy Child Uganda works to strengthen training and research for local faculty and students in maternal, newborn, and child health, and to find evidence to inform policy nationally and internationally. Strong evaluation of all of its programs is a key component of the success of Healthy Child Uganda, finding what works and what doesn't work. One key reason for its success is the integrative nature of the projects. Healthy Child Uganda aims for integrated programs.
The project has focused mostly on the district level, where it has prioritized maternal newborn child health issues, moved to the health centers where health workers have been equipped with skills on maternal newborn child health. Health facilities have been equipped with basic equipment to support service delivery, and the strongest sort of intervention has been in the training of the volunteer health workers, the VHTs, who it is hoped are going to be the driver for improvement of health of mothers and children.
Healthy Child Uganda is a partnership, Ugandan-Canadian partnership. We work to develop, implement, and evaluate our programs that really can make a difference for a lot of people, particularly mothers, babies, and children living in some of the most vulnerable conditions that one can imagine.
Healthy Child Uganda is a wonderful story about creating real change for the most vulnerable women, babies, and children living in southwestern Uganda and other low-resourced environments. It's an exemplary model for change that could transform lives throughout Africa.